Richard Andrews. I'm Director of Sales and Marketing at Health here, and today I'm pleased to be joined by Dr. Mark Froimson to chat about the future of orthopedics. Mark is a member of the Health here team and brings our company an incredibly valuable perspective given his years working across a number of different areas in orthopedics.
Yeah, thanks, Richard, and happy to be here talking to you, even if it's remote. And as you say, I'm an orthopedic surgeon at heart, has spent most of my career fixing people, putting in hips and knees, and have more recently kind of had the opportunity to experience the healthcare system. I actually got involved in healthcare administration, trying to understand how health systems work because of the friction that a lot of providers have. I think it's part of our obligation as physicians to try to fix the system. And so I've had a lot of opportunities, both at Cleveland Clinic, Trinity Health, through AAHKS, through some relationships with payers, to try to understand, the aspects of the healthcare system that people think are broken. What I'm focusing at this stage of my career on are identifying what I call paradigm shifting solutions that are going to enhance the nature of the physician-patient relationship. What I've seen working with you guys at Health Here is that incredible focus on the patient, the physician, and the way in which we can help them interact.
Yes, that's kind of our perspective. Is we're hyper focused on that patient provider relationship and solving problems for the folks who are right on the front lines of healthcare, and we think they're have some of the best insights, and so that's what we're developing our solution for.
Yeah, so there's an interesting phenomenon that's occurred, which is that a lot of the patient-specific responsibility, whether it's through various forms of coinsurance, deductibles, copays, out-of-pocket expenditures, all these things are falling more and more heavily on patients. We have not done a great job as a system of providing them with the answers to those questions. What have these changes meant to their individual responsibility, and how can they optimize their ability to what I call shop for care? I mean, I think that what's happened in society writ large is that we've taught people how to use technology to get better information about the products or services that they're looking for, how to compare products and services through digital interfaces. It's incumbent upon all of us who provide services to patients to understand that we're going to be judged and we're going to compete based on our ability to provide our patients with information about who we are, what we offer, and what that means to them. And so I think, what we offer at Health Here with regard to giving patients a window into cost is an important part, but it's not the only part. I mean, I think it's really important that we understand that there's a relationship here between the consumer, the patient, and the provider. And to the extent that we can make that relationship more seamless, that's going to weigh, I think, just as much as what the absolute price is for the service being offered.